It's the second hour of power. Wednesday, January 29th, 2014. Welcome back, ladies and gentlemen. I'm Dr. Peter Glidden, talking about all things holistic, helping people to get a clue about stuff that is so far outside of their frame of reference that they didn't know that. Everybody's up against it here. Everybody is sick and tired of being sick and tired, but they don't know where to turn. Well, we are the answer. We are the red pill to snap you out of the matrix of conventional medical insanity and actually do some real, clinically verified, science-based stuff which supports and promotes your body's ability to fix itself. We're talking to Rebecca from Ohio. Rebecca, are you still with me?
I am still with you.
All right, thanks for hanging on. So, like the fella said, from the proper perspective, everything makes sense, right? So, from our point of view, in order for the human body to function the way that God intended it, you need 90 essential nutrients every day. And that's the stuff that's in the Healthy Start Pack, the Ultimate Classic, and the supplements that you're taking. 90 essential nutrients every day. But because nobody knows this, people will go their entire lives under-nutrified. And then when you get pregnant, oh my God, the baby steals half of what little nutrition you have, which is why most, well, I can't say most, but which is why an abundance of physical ailments happen to women after they get pregnant and deliver. Because for 9 months, their bodies have been completely undernutrified, whereas before, they were just a little undernutrified. But when you're pregnant, the baby steals your reserves. Most people have limited reserves. So this is why we get eclampsia and postpartum depression and diabetes during pregnancy and all kinds of birth defects, quite frankly. So from our point of view, the catalyzing event here was the pregnancy, and that took advantage of, in a negative way, your body's under-nutrified status, and then you just kind of, once you got on that nutritional deficiency track, you know, things just started to go downhill from there. Now, interestingly enough, from our point of view of heartburn, regardless of what the MDs call it, regardless of whether they call it GERD or esophageal reflux or silent esophageal reflux or whatever they're going to call it, is caused by a calcium and a salt deficiency. We believe that the operative things here are not enough calcium and not enough salt in the body. But really, what we do here, we don't really try to micromanage anything. We just step back, take a look at what's going on, and provide the body with everything that it needs nutritionally, appropriate for body weight. Stop eating stuff that's coming up the works, and get out of the way, and let the body bounce back. Now, given your history, given your current symptoms, a better program for you to try for 90 days, 3 months. Well, what's your current body weight, I guess I should ask, Rebecca?
140, and I'm 5'4".
Okay. So what I would do per month for 3 months in a row, every month, I would do one Healthy Start Pack, the original, one original Healthy Start Pack. I do one Healthy Start Pack, one Beyond Osteo FX, one bottle of Beyond Osteo FX, 3 bottles of Ultimate Selenium, SELEN like Nancy, IUM, and 1 or 2 bottles of Ultimate Enzymes. Now, the enzymes are interesting. See, from our point of view, food allergies are capitulated and caused by facultative breakdown in the tissue of your small intestine. The tissue in the small intestine has been damaged, and that leads to something called a leaky gut, and the leaky gut leads to multiple food allergies, which are then exacerbated by chronic nutrient deficiencies, especially postpartum. So, well, inquiring minds want to know, right? Well, what is it that causes the intestinal environment to become damaged? Well, the biggest factors are wheat, barley, rye, and oats. Wheat, barley, rye, and oats, gluten, and then the other 10 bad foods. But the big bad voodoo daddies here are gluten-containing foods. But, you know, it's kind of like the 1-2 punch, right? Because if you eat food that's damaging the intestinal tract all of the time, unwittingly, and your body doesn't have the nutrition that it needs to fix it, well, It's only a matter of time until that catches up with you in a big way, and then things really start to hit the fan, and that I believe that's what's happened to you. So a better, more rounded, efficient nutritional strategy for you for 90 days would be the Healthy Start Pack, selenium, and the one extra bottle of Beyond OsteoFX and the Ultimate Enzymes. Now, remember, this is a holistic methodology. And holistic medicine argues that the body is a complex system of interrelated parts which is generated and organized by the intelligence brought to your body by the presence of your spirit or the soul that's in the body. So, because everything's connected and because everything's being directed, once you clean your diet up appropriately and give your body the right stuff in the right amounts, you should experience slow and steady improvement across the board. So, sleep, mood, energy, menstrual cycle, sex drive, appetite, weight gain, recovery time, post-exercise, all of these things should increase, which brings me around to the exercise question. Because look at it this way. Our whole position is that your body's undernutrified. Everybody's body is undernutrified. It's impossible to secure all 90 essential nutrients from eating food. You can't do it. So if you have an undernutrified body and you get on the treadmill, or you do a P90X program, or you start sweating bullets, or you really drive the body hard, you're going to accelerate your nutrient deficiencies. Because the intention of exercise is to stress your body out, so that then post-exercise, your body makes that part of your body, those parts of your body that you just stressed out, stronger, right? I mean, the intention is to break the muscle fiber down so your body strengthens it. The intention is to stress the cardiovascular system out so that your body strengthens it. But the body needs nutrients to strengthen the tissue, and you don't have any. Now, here's an interesting statistic. I mean, when I realized this, my head exploded. 400,000 people a year in the United States die from cardiac events, heart attacks, which are a direct result of exercise. That's more people than die on automobile accidents. So, exercise without nutrition is suicide. But exercise with nutrition, superwoman. No kidding. I mean, no kidding. It makes all the difference in the world, right? I mean, it makes sense, right?
Yes, it does.
All right, good. So knowledge is power, and my people are destroyed by lack of knowledge. So there's one extra thing that you might want to do because, you're motivated here to exercise. And I got to tell you something. Anybody that does P90X, I mean, I've got a lot of respect. That's not an easy program. I've got a lot of respect for people that get into an aggressive workout program like that. So, longevity, working with an NBA guy, the second oldest player in the NBA, Theo Ratliff, developed a workout. It's kind of like Healthy Gatorade, and it's called Rebound FX. Rebound FX. Now, if you're a workout fanatic, my advice to you is, in addition to the Healthy Start Pack and the selenium and the enzymes, that you get a bottle of the Rebound FX powder. It's in a powdered form, and you add some to your water, and use that before, during, and after your workout instead of vitamin water or Gatorade or whatever else it is that you're drinking. If you start to use the Rebound FX during exercise, you'll notice a remarkable difference, and it'll take less than 48 hours because, like I said before, your body is starving for nutrition, but we've kind of gotten used to it, and then when you exercise, it gets even worse, but we've gotten used to it, and so when you get a clue and give your body the right stuff in the right amounts, everything changes, and I got to tell you something, Rebecca. In about a month, you're going to love how you feel. And that's why we do this, right? Because the proof of the pudding is in the eating. I mean, I can talk a blue streak and, explain biochemical pathways, and all of this is great, but really none of it matters unless we get results. And you heard Allison's testimonial.
Yes.
I know, right? And it's the tip of the iceberg.
Makes me feel better.
Yeah, I know, right? Yeah. So, really, we lean on results, and if you're doing the right stuff, then you should be getting results every couple of weeks. And that's what we lean on here. Slow and steady, systematic improvement. Remember, healing is a process. It takes time, but when we do the right stuff, you should be feeling specific and measurable, noticeable change every 2 to 3 weeks. Does it sound like a plan?
Yes, I have one more question. You say the Healthy Start Pack. I bought a case of the Ultimate Classic, the EFA, and of the minerals. Is that the Healthy Start Pack?
No, that's called the Ultimate Classic Pack, and that was one of the earliest iterations of the 90 Essential Nutrients. It's a good program, but there's a second and now a third generation program, so that's kind of like, Windows 3.0, right? And now we've got Windows 7, and so it is better. So when you run out of that, what you want to get is it's just called the Healthy Start Pack, the Healthy Start Pack. Now, since you've got a case of that and the EFAs and the plant minerals, it would benefit you because of your health history to get 1 bottle per month of the Beyond Osteo FX, and that's a white liquid calcium. You need more calcium than you're getting now. There's a little bit of calcium in the Ultimate Classic, but you need more. So get 1 bottle of Beyond Osteo FX every month, plus the selenium. The selenium is extremely important. You know that 2 of the longevity capsules of selenium a day reduce the occurrence of breast cancer by 82%. 82%. Also reduces lung cancer, also reduces colon cancer, also reduces prostate cancer to remarkable degrees. I mean, this is the best stuff to happen to medicine since the sterile technique, as God is my witness. We're up against the hard break, Rebecca. Thanks for your patience. Thanks for your trust. Thanks for hitching your star to the longevity wagon. And now let's give it some time and see what happens. Stick around, folks. We're going to go talk to Donna in Connecticut when we're back. Word is spreading. Hard to keep the truth down, right? Once you've experienced the truth, you're in its velvet grasp forever. MDs might mean well, but they don't know well. This from Duffy James in Seattle, one of our biggest promoters and supporters. MDs mean well, but they don't know well. I like that. Let's go to Connecticut and see what Donna's up to. Hey, Donna, thanks for the phone call. You are live.
How you doing?
How you doing?
I'm doing good.
Yeah, me too, but I'll get better. What's happening?
I have a friend who has multiple health issues.
Yeah.
He's ready to try you. I talked to him before, and now he's ready.
Yeah.
Okay. He's got diabetes.
Yeah.
He's got high blood pressure.
Yeah.
He's got cholesterol problems.
No, he doesn't.
Yeah, I know. That's what they're telling him.
Yep.
And they're telling him that he has blockage in his heart. They just told him that. He has leg cramp.
All right. Did they tell him the blockage in the heart was a calcium deposit or cholesterol plaque?
I don't know. I didn't know what to ask. I didn't know.
All right. Keep going.
He has leg cramps. Sometimes he falls. He almost stumbles because of the leg cramp.
Yeah.
And he has a rotator cuff pain. He had surgery done on one of his arms with the rotator cuff. Now it's in the other arm.
Yeah.
Mhm.
All right. So these are all different arms of the same octopus, right? Different symptoms.
Yes.
Yeah, right?
Yes.
We trace them all back. It all goes to not enough nutrition. I mean, type 2 diabetes is a mineral deficiency. Leg cramps is a mineral deficiency, especially calcium and magnesium. Blocked arteries in the heart, that's caused by chronic inflammation in the blood vessels. What causes chronic inflammation? The consistent consumption of all the wrong food, and then lack of stuff in the body that the body uses to put out the fires of inflammation. High blood pressure is a calcium deficiency most of the time. There can also be a kidney malfunction going on in there, and it's possible, given the state of affairs of his blood vessels in his heart, there could be a problem with the blood vessels in his kidneys. But, the moral to this story is, right, while he's been under the care and the tutelage and the direction of the MDs, he's gone from the frying pan into the fire. He's on a highway to hell. I mean, he's going right there. His body anyway. It's bad. I mean, he's gotten worse and worse and worse and worse and worse and worse. And meanwhile, President Obama, you know, I mean, this isn't a political talk show. I voted for Obama years and years ago. There was some stuff I think that Obama brought to the table that was great. But now, this Obamacare, it's making it mandatory for people to buy into a failed medical system. It's nuts.
I have a problem with it, too. Mm-hmm.
It's nuts. I mean, it's nuts. It's bad. Mm-hmm. But I digress, right? So what's this friend of yours weigh, Donna?
He weighs 185 pounds.
Okay. So, all right. All right. So 185 pounds. So we got to start somewhere. So the recommendation would be to support and promote the structure and function of his body. The Anti-Aging Healthy Start Pack, 1 Anti-Aging Healthy Start Pack and 2 selenium per 100 pounds of body weight per month. 1 Anti-Aging Healthy Start Pack and 2 selenium per 100 pounds of body weight per month. 1 bottle of Beyond Osteo FX a month. 1 bottle of Beyond Osteo FX a month. And 1 bottle of Ultimate Daily Capsules a month. That's a very good program to start him with. Plus, of course, he's got to eliminate the 10 bad foods. And you should forward him a link to the webinar that I did on inflammation in the body, because he needs to start to educate himself about foods that are high in antioxidants. Now, in addition to the nutritional supplements that he's going to be taking that are high in antioxidants, if he switches, for instance, from white wine to red wine, or from coffee to green tea, or gets a different kind of coffee that has antioxidants in it, or starts having blueberries instead of bananas, right? He's going to start adding cinnamon to his diet, start eating walnuts, start having curry powder or cayenne pepper. He's got to increase the amount of antioxidants in his body, which is a very smart thing for him to do. So send him a link to the webinar that I did on inflammation and antioxidants. Hook him up with these products. But remember, unless he changes his diet, we're spitting into the wind. We're spitting into the wind. So send him a link to the video that I did on YouTube called Against the Grain. You know, often that helps when people hear it from the expert. You're the greatest, Donna. It's people like you that are going to change the world. Keep up the good work.
I'm trying my best, Doctor.
You go, girl.
I didn't get the last one you said.
All right, you stick around. Welcome back, ladies and gentlemen. FireYourMDNow.com is the website you want to save into your browser. FireYourMDNow.com. And if you forget that, you can always remember Glidden, right? Like the paint, no relation, Dr. Glidden. Just do a Google search for Dr. Glidden. G-L-I-D like David, D like David, E-N like Nancy. I always pop up #1. Lots of information on the website. It has a brand new look and feel, by the way. Brand new look and feel. Very easy to navigate, very intuitive, very easy to understand, and a wealth of information. Become an insider. Gain access to 100-plus hours of online webinars in an archived vault just waiting for you to watch. If you like the radio show, you're going to love the webinars, the archive stuff. Plus, we do 5 hours of live webinars a week. 5 hours of live webinars a week, available exclusively and only for Dr. Glidden Insiders. Check it out. $20 a month. It'll be the best $20 a month you have ever spent. By the way, cancel at any time. drglidden.com. FireYourMDNow.com. Let's go to L.A. and talk to Yona. Hey, Yona. Thanks for the phone call. You are live.
Hi.
Hello, Yona. Thanks for calling. How can I help?
Thank you. I'm calling to talk to you about my grandfather. He's 82 years old. He has a tumor in his bladder. It's cancerous. And I kind of want to, ask you what would be good for him to take, since, we do give him your products, but we don't know exactly what to give him.
Well, is he going to do conventional treatment for the cancer, or what's he going to do?
Yeah, right now he's doing chemotherapy. Because they weren't able to take his tumor out since he's, his age is too advanced, and he won't be able to take a surgery.
Yeah. So the chemotherapy is going to be ineffective for this. Chemotherapy doesn't work for this. The only reason they gave it to him was so they could make a little bit of money, actually make quite a bit of money. If chemotherapeutic drugs were $500, the MDs wouldn't prescribe them because they don't work. They don't work. They don't work. I'm not against drugs. I can prescribe drugs, love drugs when they work. Chemotherapy doesn't work. It doesn't. And if people started asking their oncologists hard and fast questions, then there would be no more chemotherapy prescribed because it doesn't work. So, notwithstanding that, your grandfather's been played here. He's a pawn to the pharmaceutical industry. They're just, using him like an ATM machine to rack up a bill before he dies, for goodness sake. Now, it's illegal to treat cancer unless you're an MD oncologist. You can't do it. That's why we don't have any alternative cancer treatment centers in the United States. It's illegal. It's not just hard, it's illegal. So, studies have shown that people that have bladder cancer and who take probiotics every day, there's like over an 80% chance that the cancer isn't going to come back. So we know that there's some type of relationship between healthy bacteria in the gut and healthy bladders. We don't know what that is, but if it were me and I had a diagnosis of a bladder tumor, what I would do to support and promote the structure and function of my body is the root beer belly. I would do 1 packet of root beer belly a day. I would do 1 anti-aging healthy start pack per 100 and 2 selenium. 1 anti-aging healthy start pack and 2 selenium per 100 pounds per month. And I would do as much Z-Radical as I could afford. Z-Radical. Z like zebra, radical. As many bottles as I can afford. A bottle a day, 30 bottles a month, 29 bottles a month, 28 bottles a month. I don't care. That's what I would do if I was up against a diagnosis like this. My heart goes out to you. Also, get my book. Please just go to my website, download my book. It's $10 if you download it to your computer. I have a chapter in there on cancer. You need to read it. Your grandfather needs to read it.
Will.
Everybody in the world needs to read it. I appreciate your trust, Yona, and best of luck.
Thank you.
Give us a call back with an update. So, well, I don't want to go off on a cancer riff. And I've promised this before in the past. Once things settle down for me here and this radio show generates into a 3-hour format, which we're hoping is going to happen sometime this spring, I'll be able to do segments, dedicated segments, a cancer segment or whatever, or cancer week or whatever, or heart disease week, something like this. So stay tuned, folks. The best is, in fact, yet to come. Let's go to Texas now, where Daryl has spurs that jingle, jangle, jingle. Hey, Daryl, thanks for the phone call. You are live. Come in, Daryl. Hello, Daryl. Did I press the wrong button? Daryl, come on in, Daryl. Well, we're going to wait. Maybe Daryl will be back in a minute. 866-582-9933. That's the number to call to speak to me live today or any day. 866-582-9933. If you're listening to the podcast, if you're working your job and just can't get away during work in order to listen live, you can listen to a recorded version of the radio show forever. Available on the webcast, on the website. It's podcast all the time, and there's an archive section in the website as well where you can listen to any radio show that I've ever done. If you're listening to the podcast and would like information about how to get these nutritional supplements at the wholesale price, and or talk to a living, breathing human being about the business opportunity, the number to call there is 855-347-3696. That's 855-347-3696. We're going to give Daryl one more try and see if he's with us. Daryl, thanks for the phone call. You were live. Are you here? Well, I don't know where Daryl's gone. We're going to just have to drop him. 866-582-9933. So the deal is, when we're talking about cancer, we need to be rational. Your medical doctor believes that there is no cure for cancer, that it's a sinking ship, and it's their job just to plug the holes of the ship to give you maybe an extra day on top of the water, or an extra week on top of the water, or an extra month or an extra year on top of the water. They are not concerned at all with the quality of your life. They are not concerned at all with the side effects of their treatments. They're certainly not concerned at all with the cost of the treatment. They're not concerned with anything other than providing you with the standard operating procedure protocol for cancer, and it changes all the time. But no matter how much it changes, it doesn't cure anything, because the MDs are not trained in how to cure anything. They're not. I mean, even surgeons, they're not trained to cure anything. They're just trained to sew things up, knit things back together in a sterile way, and then pull out of the body and let the body fix itself, right? The body fixes itself after the surgery. The surgeon just knits things together, and that's not a bad thing. We love surgeons. You know, we love surgery when surgery is indicated. And like the fella said, if all you have is a hammer, everything looks like a nail. So a surgeon most of the time is going to tell you you need surgery whether you do or not. But in any event, we need to just be rational when we're talking about cancer treatment or any type of treatment. So what do? You ask your oncologist, hey, doc, is this treatment you're going to give me, does it cure my cancer? Does it? What's that? You say, no, it doesn't cure the cancer. Well, what the hell? What does it do? What can I expect? What are the side effects? What are you going to do to treat the side effects? Now, how much do you profit from this ineffective, non-curative treatment? How much does the hospital profit from this ineffective, non-curative treatment? I hate to bring this up, but I understand that medicine in the United States is a for-profit entity, and I'm okay with making money, but I need to shop around here. So I need to know what your profit margin is, and I'm going to compare that to the profit margin of the Good Samaritan down the street. I'm going to see who's going to give me the better deal. I need to know what your outcomes are like, specifically what I can expect from this treatment. If you think I'm just going to do what you tell me to do just because you're the doctor, you got another thing coming. This is my life. If it's going to end because you don't know how to cure it, I want to know what's going to happen to the quality of my life in the last 6 months of my life while I'm under your care. And I'd like to talk to 10 of your patients who've had this type of cancer, whom you've treated, or their relatives if they're dead. Now, if every cancer patient had that conversation with their oncologist, there would be no more cancer treatment because it doesn't work. Daryl's finally back. Let's pick him up and see what's cracking. Hey, Daryl, thanks for the phone call. You are live.
Yes, I need some help about the Epstein-Barr virus.
All right. Who told you you had Epstein-Barr?
Well, out at the emergency room, I went out there. I was having all kinds of problems.
Yeah, and they told you you had Epstein-Barr virus?
Well, someone reported that to me.
Yeah. Well, I don't know that you do. You may. I mean, Epstein-Barr virus is a real thing, and sometimes people have it and some people don't. It's a very difficult thing to diagnose because of the way that the human body's immune system is. It's just in the testing that we have for Epstein-Barr is not sensitive nor specific, and so if you really do in fact have an infection with the Epstein-Barr virus, the blood work can come back negative. And if you don't have an infection, a current infection with the Epstein-Barr virus, it was a historical infection, the blood work can come back positive. So it's like, who knows whether you have it or not. I'm anticipating that your chief complaint here is the reason that you went to the doctor is because of a lack of energy. Is that correct?
Well, no, I got so fatigued, I just actually collapsed and fell on the floor.
Yeah, so you had so much fatigue that you collapsed and fell on the floor. What do you do for a living, Daryl?
I do carpenter work.
You're a carpenter, and you work in Texas?
Yes.
And are you do outside or inside work?
Combination.
Combination, yeah. And when you collapse on the floor, the week previous to that, were you working outside under a high heat environment and sweating a lot?
No.
You weren't.
No,
okay, good.
no.
How old are you, Daryl?
61.
61. And how much do you weigh and how tall are you?
170, about 5'11".
All right, that's a really good weight, man. I bet you're strong too. If you've been doing carpentry your entire life, I bet you're one strong mule. Listen, we're coming up against a hard break. I'm going to tell you what to do in order to get on the other side of your health here. I'm going to tell you what to do to optimize your body's health. Whether you have Epstein-Barr or not, you may, but I kind of doubt it, and I'm saying that just based on clinical experience. The Epstein-Barr virus is a very real thing, but regardless of whether you have a definitive diagnosis of Epstein-Barr infection in the body, there's a lot of stuff that you can do to support your immune system and support the energy systems of the body to give your body a leg up here, which is what you need, which is what everybody in this country needs. Because God is my witness, we've taken the wrong dog to the hunt for the last 100 years. We've leaned on the MDs for help with chronic health conditions, and they've got nothing for us but drugs and surgery, drugs and surgery, drugs and surgery, death. Stick around, Daryl. I'm glad that you called. I'll dial this in after the break. Welcome back, ladies and gentlemen. Finishing out today's show, January 29th, 2014, with Daryl, who thinks that he may have Epstein-Barr virus. He got really, really fatigued and passed out a little while ago. Hey, Daryl, are you still with me?
Yeah.
All right, good. So, with my automobile, or with anybody's automobile, it would be prudent to tune the automobile up, make sure there's enough air in the tires, make sure there's enough transmission fluid in the transmission, make sure there's enough engine oil in the engine, make sure there's enough radiator fluid and power steering fluid and so forth and so on. The car needs to be tuned up. Otherwise, if you drive it hard, things are going to start to break, and not because there's anything wrong with the car, but just because you didn't have the right stuff in it. So it's no different with the human body. When you're driving the body hard with physical labor, quite frankly, just living a life on planet Earth, you're subject to lots of stress. But people that do manual labor, and I was in the manual labor workforce for 7 years, I know of which I speak, they're driving the bodies hard. And people who do work with their bodies and professional athletes need more than the normal person needs nutritionally in order just to keep their bodies, to allow their bodies to make it from day to day. So I would hazard a guess here that one of the reasons that you experienced a facultative breakdown here and passed out with this fatigue episode is because your nutritional tank was empty. You're running on nutritional fumes, and then your body just couldn't handle it anymore, and it collapsed. So the first thing that I would recommend you do before we get nervous about trying to really pin down a diagnosis of Epstein-Barr or whatever is for 3 months to stop eating food that's gumming up the works. I mean, you wouldn't put diesel fuel in an unleaded engine. So there's certain foods that just aren't appropriate for the human body, and it would be wise and prudent for you and me and everybody else to identify these foods and to cut them out of the diet. You can get that list for free, by the way. It's called the Good Food, Bad Food List on my website, fireyourmdnow.com. Just go to my website and sign up for my free newsletter, and you get a copy of the Good Food, Bad Food List for free. And there are 10 foods that we've identified as bad for the human body, and I would advise you wholeheartedly to stop eating them, number one. Number two, at 175 pounds, in order to fill your body's nutritional tank up, to top it right off, to give your body the stuff it needs to run the way that nature intended it to, it's really quite simple, man. The recommendation for you is 2 healthy start packs a month. 2 healthy start packs a month. It's a very good place to start. 2 healthy start packs a month. And because of the work that you do outside, I would also get a canister of something called a Rebound FX. 1 canister of Rebound FX I want you to do the Healthy Start Pack dose before work and after work. And I want you to take the Rebound to work. I want you to put it in a water bottle and drink the Rebound FX all day long instead of Gatorade or vitamin water or whatever else it is that you drink. Now you can still drink. You can still drink coffee. Are you a coffee drinker?
No, I just drink tea.
Yeah, tea. Or you can still drink tea, but if you add the Rebound FX, just put a little bit of that powder in a water bottle and stick it in your lunchbox and drink from it all day. You're going to feel much better. This is going to take about 7 days to kick in, Daryl. 7 days to kick in. You might feel better before that, but once you fill your tank up with the right stuff, man, things are going to start to come around. Now, it's entirely possible that there might be an infectious organism in your body as well, but either way, your body's going to need to be nutrified. So what I would do to kind of clear the fog, clear the smoke, is clean your diet up, fill your nutritional tank up every day with the right stuff, see how you feel. I mean, this might be all that you need to do. Time will tell, and the proof of the pudding's in the eating. Daryl, how'd you find out about this radio show, by the way?
One of the distributors gave me the number.
Oh, great. So get in touch with the distributor, and they'll get the stuff.
Could I tell you a few more symptoms?
I can't, buddy. We are dead out of time. I'm up against the bottom of the show here. You can call back tomorrow, and I'd love to talk to you, but not today. Regretfully, we're out of time. Get in touch with the distributor who sent you to this radio show. They can help you get the nutritional supplements at the wholesale price, and that beats a poke in the eye with a sharp stick. Ladies and gentlemen, I'm Dr. Peter Glidden, your steadfast advocate for health. We have a special guest with us tomorrow, Dr. Russ. You're going to love what he has to say. Until we meet again, I'm Dr. Peter Glidden, reminding you to live long and prosper.